Hi, lovely people. Welcome once again. In this episode, we are looking at a very, important thing that happens in our system. People often have a name they use for it. They call it heartburns, heartburns. But what's the clinical term or the medical term for this? This is known as acid reflux. And you would also hear something they call gastroesophageal reflux disease, GERD, is the same as the acid reflux. So, what is this? This is a disease, or this happens when acid flows back into the tube, esophagus, and that's the tube connecting the stomach and then the mouth. So, this is when acid flows back from the stomach into that tube. This happens when the lower esophageal sphincter, a small muscle that acts like a valve in the system. That valve is supposed to be preventing the acid from flowing back into the tube. Doesn't this happens when this same valve doesn't close properly? This is what causes the acid to bounce back, causing acid reflux. It could be a more severe and then long lasting thing. When it becomes more severe and long lasting, that's when it's called GERD. That's the gastroesophageal reflux disease. If left untreated, it can lead to complications such as ulcers, inflammation, and even damage to the esophagus due to the acidic nature of the gas or fluid flowing back into the tube. What causes acid reflux? Several factors contribute to acid reflux. Some are weak or weak weak lower esophageal sphincter. When the muscle between the stomach and the esophagus doesn't function properly, it leads to acid reflux. Overeating. People eat large meals, put severe pressure on the stomach, making acid more likely to escape. Immediately lying down after eating could also cause this. Certain foods and drink also relax the lower esophageal sphincter, that muscle, and that happening causes increase in acid production. And some of these foods are, we have spicy foods, we have citrus fruits like oranges, lemon, we have tomatoes and tomato based products, we have chocolates, we have caffeine, alcohol, fatty and fried foods, we have mint. And another cause of acid reflux is obesity. Pregnancy due to hormonal changes also causes acid reflux. Smoking, almighty smoking, could also cause acid reflux. And then certain medications, their contraindications or their side effects is acid reflux. Common symptoms of acid reflux, we have the heartburn, which is very common. We have regurgitation, a sour or bitter taste backing up in the throat or mouth. We have difficulty in swallowing, feeling like the food is stuck in your throat. We have voice changes. We have chronic cough. We have bloating or burping. And if you experience any of these symptoms regularly, the best to do is to seek medical attention. And let's look at some complications of acid reflux. Esophagitis. This happens when the esophagus becomes inflamed due to the repeated acid exposure. We have esophageal strictures. Scar tissue from acid can damage the narrow esophagus, making swallowing very difficult. We have the Barrett's esophagus, a condition where the esophagus lining changes, increasing the risk of esophageal cancer. We have respiratory issues. Acid entering the throat or lungs can cause asthma, chronic cough, or pneumonia. And how is this condition diagnosed? We look at the medical disease, the symptom review. There's also a process known as endoscopy. A small camera is inserted through the throat to check the esophageal damage. We have the pH monitoring, a test that measures the acid levels in the esophagus over a 24-hour period. We have the barium swallow x-ray. You drink a special liquid that helps highlight reflux related issues on an x-ray. And then we have the treatment. Let's look at the treatment and management of acid reflux. We have lifestyle changes. We have making small adjustments to your daily routine can significantly decrease acid reflux. And some of these things you can do, the things you can do are eating smaller meals, avoid trigger foods, don't lie down immediately after eating, elevate your head while sleeping, lose weight if overweight, quit smoking and reduce alcohol intake, wear loose fitting clothes. And there are some medications for treating acid reflux. We have antacids, we have H2 blockers, proton pump inhibitors, and prokinetics. For severe cases, surgery can be initiated. If medications and lifestyle changes don't work properly, surgery may be an option. The most common procedure is fundoplication, where part of the stomach is wrapped around the LES. The LES is the lower esophageal sphincter. Part of the stomach is wrapped around it just to strengthen it to prevent the acid from bouncing back. Let's look at some home remedies for acid reflux. We have the ginger tea, we have aloe vera juice, apple cider vinegar helps as well. Chewing gum, bananas, and oatmeal also help in acid reflux. Now let's look at when to see a medical practitioner. Seek medical attention when these symptoms occur more than twice a week, when you have difficulty in swallowing or breathing, when you experience unexplained weight loss, when you have chest pain and could be mistaken for heart attack. Over the counter medications also no longer helping with this problem is also an indication for you to visit a medical practitioner. Now let's look at some final thoughts on this. Acid reflux is a common but manageable condition. It's very common, but it's also very much manageable. By making lifestyle adjustments and simple changes, you can overcome this problem. Thanks for staying with us once again. Like our comment, our content, subscribe to our channel, and don't forget to share. Thanks for watching and expect more from us. Thank you.